How accurate is the Ca-19-9 test for pancreatic cancer? Imagine trying to catch a tiny fish in a vast ocean. That's similar to how doctors use the Ca-19-9 blood test to find pancreatic cancer. This test measures a substance called a tumor marker, which can be higher when pancreatic cancer is present. But how reliable is it? The truth is, it has its strengths and limitations. In people showing symptoms of pancreatic cancer, the Ca-19-9 test correctly identifies the disease about 79 to 81% of the time. That's called sensitivity. It also correctly rules out the disease in about 80 to 90% of people without it, which is called specificity. These numbers mean the test is fairly good at detecting pancreatic cancer when it's there and ruling it out when it's not. However, it's important to remember that a positive result doesn't always mean cancer. Elevated Ca-19-9 levels can also happen in other conditions like bile duct blockages, pancreatitis, or other gastrointestinal issues. This can lead to false positives, where the test suggests cancer when there isn't any. Conversely, some people do not produce Ca-19-9 at all due to a genetic trait called Lewis antigen negativity. About 5 to 10% of people with pancreatic cancer fall into this group, meaning the test might miss their cancer entirely. These are called false negatives. The test isn't recommended for screening healthy people without symptoms because many elevated results are not due to cancer. Its positive predictive value, which tells us how likely a positive test actually indicates cancer, is very low in people without symptoms. That means if you have no symptoms, an elevated Ca-19-9 doesn't necessarily mean you have pancreatic cancer. Clinicians often use Ca-19-9 alongside imaging tests like CORT scans and other diagnostic procedures. It can help support a diagnosis in symptomatic patients and provide useful information about prognosis. For example, lower levels before surgery often suggest a better chance of successful removal, while higher levels might mean the cancer has spread. During treatment, decreasing Ca-19-9 levels can indicate that the tumor is shrinking, and rising levels may signal recurrence. Researchers are also working on new tests that combine Ca-19-9 with other markers to improve accuracy, especially for early detection. Some of these combined tests have shown promise with higher specificity and sensitivity, but they are still under study and not yet part of routine practice. In summary, the Ca-19-9 blood test is a helpful tool for managing pancreatic cancer, but it isn't perfect. It should be used carefully and always interpreted by healthcare professionals within the full context of symptoms, imaging, and other tests. If you have concerns about pancreatic health, it's best to discuss them with your doctor, who can guide you through the most appropriate diagnostic steps based on your individual situation.